is not elective to make women feel better. Women need a combination of things in order to have health optimization that lead to living longer but healthier.
Dr. Jila Senemar, a board-certified OB-GYN and the founder of Gila MD, spent over 2 decades listening to women and translating that lived experience into hormone therapy protocols, plans, and midlife care that don't settle.
Listening to so many women with complaints and not have an answer that felt good. That's what kept me up at night.
You say that hormone therapy should never be one size fits all.
It really depends on the patient. Most women are candidates for hormone therapy, but women need to be looked at as a whole.
4% of eligible women are on hormone therapy. It feels like menopause care is still decades behind.
We're behind. We have people who want to help women, yet most have no idea what we're even talking about.
How are you redefining what hormone health includes?
It's not just about hot flashes and mood swings anymore. It's
Expert care for menopause and sexual health, now just a click away. Virtual Care by Her MD offers longer visits, personalized treatment plans, and trusted providers, all from the comfort of home. Learn more at hermd.com. This episode was sponsored by Her MD.
Content of the Disruptor podcast is for informational purposes only and does not constitute medical advice. Please consult your healthcare provider for personalized guidance regarding hormone therapy and all your medical decisions. How have you been, though?
I've been good. A lot of moving parts, a lot of things in shifting, changing, but good stuff. Really good. I'm excited for the fall.
Your clinic looks amazing. It just looks gorgeous. I'm so happy for you. It brings back so many memories for me, but so proud of you. So congrats on that. I got to see that on Instagram. It's beautiful.
Yeah, I'm excited. It's fun. It was a labor of love. So you can relate to how that feels when you finally have your own. And it's like, okay, I'm done. I don't have to answer to anyone but me. And it's a nice feeling to have.
It's a duality, though. It's that freedom of, I described it as like jumping off a cliff. Like when you, it's like, oh my God, I'm flying. Oh my God, I'm dying.
Moments, where you're like, what did I just do to myself?
What did I do? Are they going to come? Yeah, yeah. So I remember being, other than when it comes to personal things, the most scared I'd ever been in my entire life. So, but it is incredibly freeing. And when you finally do it, it's like, oh, I did it. And I'm my own boss. And that's pretty cool. Yeah.
It's exciting after so many years, right?
Yes, I know. It takes so many years. People ask, well, why didn't you do it younger? I'm like, I was in medical school and residency.
Yeah.
Taking my boards, like doing all the things we need to do.
I think we were like setting the stage for this because I think if we did it earlier, it may not mean as much, right?
Or feel as good when you finally get there, right?
Yeah.
But I remember when I was fundraising, they thought I was so old for an entrepreneur, and I would look around the room, and I was one of the oldest ones. But it is because in medicine, there is all that time spent studying and in school, and even to the point where you're allowed to practice medicine on your own. And then I feel like you have to build credibility and that experience. You've got to see a lot of patients and get that under your belt first,
Yeah, so, to have that comfort level to make the jump, right?
Yeah. You don't meet many 25-year-old, you might meet 25-year-old tech entrepreneurs, but you don't meet a lot of 25-year-old medical entrepreneurs, that are, it just doesn't happen at that phase in our life. But after I turned 50, I realized it's not a race. Like I'm doing things on my own timeline,
Agreed.
All right. So getting back to what you and I do for a living. Midlife medicine doesn't need a makeover. It needs a rebuild. Dr. Jila and I are already doing it. And today we're going to go deep into the how and the why. So you and I both started in traditional OB-GYN care before realizing that midlife was where real innovation and honestly real need existed. What was your tipping point? What did it for you?
I think it was watching and listening to so many women come in with complaints and not have an answer that felt good to give them. I just kept kind of being like, okay, well, let's look into that. Let's see what's going on with you and putting the pieces together. Because remember, perimenopause, menopause wasn't a discussion when we were in training. We were right in the midst of the WHI. So when it came out, I'll never forget, my attending was like, well, then we're done with that. We're not doing that. So don't worry about it. Yeah, it causes cancer and it causes heart disease. And so we don't really need to go down that path. And so just tell them no, and that they'll get over it and they'll get better. Literally, that's what we were told in training. And remember, we're in our 20s at that point. We're really focused on obstetrics and becoming really great surgeons and doing all of that. So it really didn't seem that significant at the time to kind of be like, to kind of ask further. Well, what if we weren't there? I wasn't there. I was more focused on being a good doctor, a good surgeon, doing everything I'm supposed to. So it didn't click until I kept hearing it over and over again in this huge practice that we run. And I was like, these women I've known for, 15, 20 years. I've been through all the reproductive life with them, watch them get married, have children, get them through all of that without any issue. Here we are, and they're asking me these questions, and I'm thinking to myself, yeah, it could be hormone changes, but what do we do about it? And it was a little bit here and there, a little touch and go, do some birth control pills and, things like that. And it would help a couple, but not many. And it was just more and more. And then it started affecting me personally. And I was like, there's something here that we need to know more about. And I reached out to colleagues and asked, hey, what do we do about this? And they're like, well, there are other doctors you can go to, and, they'll basically functional medicine, go to them. They'll write some, make some creams up and do this and that. And this didn't sit well with me. I was like, no, there's got to be more. It doesn't make sense.
There has to be more. And as doctors and surgeons, we're fixers. We want to fix the problem.
We want to have an answer for everybody. We can't just kind of be like, yeah, go ahead. It's fine. It'll be okay. And so that's what kept me up at night, honestly, besides my hot sweats and just waking up at 3 a.m. It's what really was running in my head. I was like, I don't feel satisfied. I don't feel I'm providing the same level of care that I can in OB and GYN and robotic surgery and all of that. I need to do better. And basically it was a digging game. You just start digging the rabbit hole and it pops up.
See, they told us in residency, we must have trained right around the same time, that we would not be supported if we continued to treat our patients. And at that point, remember, it was treat patients with hormone therapy, shortest amount of time, shortest duration. And that's before WHI. And then once that came out,
it was like
literally off the table. And I remember being told, and it's so funny now what we heard with the FDA hearings and what you and I know as menopause specialists, but why would you offer a woman a therapy that could kill her, right? Because of all those warnings, heart attack, stroke, for a hot flash that won't kill her. And it's like, hot take, menopause can actually kill you, right? Hip fracture, dementia, urosepsis. I mean, that's just to name a few. So it's so ironic that here I am in a residency program and they're telling me the fix is worse than the ailment. When we know that that's not true.
Correct. Right.
And so I felt like a really, really bad doctor. And the same thing that motivated you, patient stories and mission, are what got me to take that crazy leap too and to open my practice. So very interesting. And I think those are the most successful people, by the way, people who are driven. This is what I always tell founders, doctors, anyone who wants to follow their dream and their passion is the most successful people are those that are driven by mission and not the dollar. I think success follows.
So it comes, it's you can't be doing this as a business move, a niche, jumping on a bandwagon. This isn't where it's at. It's not about that. It's about giving what you know is the right thing and doing the right thing. And it follows, like you said. Like, I have never looked at how much is this going to cost, and maybe that's a downfall of mine. If you ask my husband, he'll say that, but that's okay. I keep pushing forward. Like, nothing stops me. I'm like, you know what? I don't care how much it is. I'm going to do it because it's going to be okay, because I know deep in my gut, I'm doing the right thing.
Well, and you've also done years and years of, I didn't know this until I got into rooms with business types, field research. But by listening to those patients, you know there's a need. So you've already figured that out. And so that's why, even though you might not be thinking about the dollars, you're thinking about the patients, you're mission driven. And for those of us who care for patients and are in the rooms and listen to the stories, we understand that healthcare is a relationship, that it's not transactional, right? And that's why patients come to us.
Right. They see that, Somi. They can see through all of it. So if they know you're truly there for them, they appreciate that. And you build that relationship.
You build that relationship. And I think for me, it's the tears of finally them feeling like they're heard and they're seen. And literally when I'm exhausted, right? Because I'm mothering, I'm founding, I'm doctoring. And it's like, that's literally sometimes all it takes is an email or a note from a patient saying, oh my God, you saved my life. You saved my marriage. You found my cancer early because you took the time to listen. And so that's the little bit of fuel I think it takes for a true mission driven provider or entrepreneur. So you say, and I agree, that hormone therapy should never be one size fits all. Walk us through like your clinical decision tree about that statement, and how do you stay true to the science and the data, but still keeping it very personal?
It really depends on the patient and the relationship I have with them, because a lot of them, like I said, I've known for many years. So we have built in that trust relationship. So they're like, whatever you say goes, I'm with you. I'm not going to listen to all the noise, and I'm going to listen to you. Those are the easy ones, in my opinion, because, we've proven to each other where we stand, and they understand that I'm driven. I'm looking at the data. I'm looking at all the studies that are up to date. And I explain to them, this is what it is. You don't have any risk factors. All of your tests are up to date. You're basically a low risk individual to be on hormone therapy, which, as we know, most women are candidates for hormone therapy.
One more time for the people in the back.
I'm not going to say everybody, but most women, if listened to appropriately and had appropriate care, are candidates for hormone therapy. So as long as we know that, and we discuss it with the patient, we go through everything, and they have, I have them fill the questionnaire out, and we know what they're dealing with. Yes, we're going to start them. The question comes with the other patients who are either new to me, and so we need to build the relationship, or are hesitant. And so I will walk them through it. I'll say, okay, what are the symptoms? Let's go through this. Is this affecting daily life, your quality of life, how you're functioning? Yes. Okay. Let's talk about the whys, the pros and the cons. Where are you in your journey? Are you perimenopausal? Are you menopausal? What's going on, and how can we best address it? I will always start with lifestyle modifications, as we all do, because those are the things that are going to pay us forward. Moving on, okay? Your
They
lifestyle.
go hand in hand. They go hand in hand.
Together. You can't just fix one thing, and it's a pyramid, right? You got to have a strong base in order to be able to layer everything else on top of that base. And so I start with them with, okay, what's your diet like? What does your exercise regimen look like? How can we modify those? How can we make them better? I do, routine lab testing, checking for everything under the sun, basically. Why? Because it could be their thyroid, it could be an iron problem, it could be hormonal, which most of the time it's a combo of all of those.
Absolutely.
And so you have to rule that out, and it's funny, my assistant's like, but what do we, she's been with me. So we're evolving the practice, right? I'm like, she's like, but you're a gyno. What are you looking at biomarkers for the heart for? I'm like, well, because you know what? I'm learning, I'm evolving, and I want to do more. I don't want to just be standard by the book. There's more out there. Women need to be looked at as a whole. It is not just reproductive area, breast and vaginal tissue, all of that. No, it's everything. It's from head to toe.
It's way beyond bikini medicine, and I just fell in love with you all over again because I nearly lost my mom at 45. So I am doing all of the cardiac screenings as well, because patients, even with elevated cholesterol, are being told, just come back in 6 months. I'm like, what magic is going to happen? What? Like if we're preventing disease and we're saying that hormones are part of longevity, then why aren't we investigating the etiology of the number one killer of women, more than all cancers combined, our heart? And then we have to take care of brain, and we have to take care of bone. And so we best be checking all of those things. Otherwise, we're doing our patients a disservice. And so Earlier, we alluded to stigma that was really holding menopausal care back educationally. And you and I were in the midst of that WHI storm that hit. But tell me why, despite 2 New York Times bestsellers that are out there on menopause and others that had been out there, and celebrities like Naomi Watts and Halle Berry and Stacey London being front and center and kind of joining hands with us and saying, we won't take this anymore. What do you think the breakdown is still going on, that only 4% of eligible women are still on hormone therapy? And it feels like menopause care is still decades behind where it used to be and where other countries are. Like, what do you think is going on culturally? We know educationally and we know data. Yeah.
Right. What's going on?
Why? Yeah.
Well, it's our communities. Look around, right? How many of us are there that are actually looking at the data, actually up to date and care? Even the Menopause Society. What do we have? 10,000 members right now? Where's everybody else? Where are the rest of them, right? We're behind. Our community providers, healthcare providers. I'm not going to say doctors, because there's doctors, there's nurse practitioners.
Yes.
We have a slew of women out there, or docs, or provide healthcare people who want to help women. Yet, most have no idea what we're even talking about. We have people and doctors in other specialties, cardiology, fighting a fight. Like Jane Morgan will tell you, she's the only one who understands hormones. Nobody else is helping her fight her battle with doctors. So it's definitely upon us to educate our peers, our colleagues, the ones who are open to it. There's only so much we can do by having events, by talking openly, bringing other colleagues in and saying, hey, let's talk about this. Why don't we go through the information, the data, the WHI, let's break it down. That way you see this is not just a one-sided equation. This is something global. This is something that we all need to be on top of. That way we can address it across the board and really eradicate these walls that have been put up to, prevent women from getting the care they need and deserve.
And those of us with a platform and a voice and that knowledge base and the time really need to change guidelines. I can't tell you how many times I'll go into a room and I'll teach physicians. And then it's like, well, the guidelines say, and I'm like, if you wait for the guidelines and don't follow the data, unfortunately, you're going to be waiting another 20 years and you may be doing your patients more harm than good. But for those of us who can sit on committees, who can take those stages, I think we also need to really work on guidelines, because a lot of doctors will depend on those because they don't have the time to go to CME, or maybe they don't have the time to become a menopause, trained provider. But at least they can know enough to get their patients in the hands of someone who does, or they can have accurate, evidence-based guidelines.
Yep.
Yes. So we have to work on that.
There's a lot of work to be done, but you know what? We're getting there, slowly but surely.
We're getting there. I will be honest with you. More has happened in my lifetime of practicing medicine than I thought there was ever going to be. And the amount of momentum we've had, I'd say in the last 2 to 4 years, I think has been pretty incredulous. So I'm pretty proud to stand alongside, all of these trailblazers, and it's going to take all of us together. But I agree with you. I'm optimistic for the first time in a really long time for women.
Yep.
So you use words like metabolic care, emotional rhythm, cellular energy when talking about menopause. How are you redefining what hormone health includes?
It's more than just hormones, reproductive. It's metabolic, right? It's mental. It's on a cellular level. We know how all of these hormones, specifically estrogen, how that works to help the little mitochondria do what they need to do. So they're all interrelated. You can't just take one and the other and kind of dissociate them from each other. I think in a very long time there is it's come to terms where now conventional medicine and functional are kind of having a crossroads here, and we're seeing a lot of the functional medicine doctors kind of come on board toward the platform as well and say, well, we've been doing this for years, where have you guys been? And I give them credit. They're not wrong. They've been ahead of the curve with a lot of this. But as you know, functional medicine was thought as woo-woo medicine, and we really didn't give them the credit they deserved back then. And now we're realizing, hey, you know what? This is where it's at. Women need a combination of things. It's not one or the other. You need to look at everything together in order for them to have health optimization. And what does that lead to? It leads to longevity. It leads to living longer but healthier. You don't want to just live to live. You want to live with quality of life. You want to be able to run around after those kids, and you don't want to be in a nursing home, with a wheelchair or a walker or any of those things. And we're living longer. We're living healthier, and we're just a different generation, and we're going to age that way as well, differently than our mothers, grandmothers, and things like that. So looking at it from a metabolic standpoint, we know where estrogen plays such a big role in all the metabolic pathways, neurologic pathways, bone formation and breakdown. So we know where it is. And so we need to really hone in on that. It's not just about hot flashes and mood swings anymore. It's from head to toe.
Oh, it's from head to toe. And I, even as an expert, I say I'm a forever teacher, but I'm a forever student. And I learned so much from my peers and colleagues. And I will tell you the number one habit I have changed. So I've always eaten really well. I've always exercised. I love being outside. I love moving. But I have been lifting weights, and I remember being so resistant because I hated it. But then I read the article, The Musculoskeletal Syndrome of Menopause, and then was watching all of you, and I'm like, all right, fine. I don't want to be frail. I don't want to fall. And I don't want to live in a nursing home or longer, but spend, my last decade of life in poor health. Like, I want to be out there traveling the world and climbing mountains and keeping up with my grandkids, not just my kids. And so that is something that I have definitely been inspired by all of you to change, even for myself personally, and really make sure that I talk to my patients about it. So you talked about community. And I feel like we all know each other better than we actually do because we keep up each other on Instagram. So you threw a really powerful event down in Miami, right? Tell me a little bit more about that.
It really came on the heels of the M Factor screening that I did in November. That's kind of where it all was sparked because, I went to the Menopause Society meeting in Chicago last year and met everybody and was just overwhelmed, inspired, you name it. I just didn't know where to start. I came home with my head exploding, and I was like, what do I do? How do I do this? And, the M Factor was released and you were able to screen it. So I was, fortunate enough to get it down to Miami. And I started planning that out. And what was supposed to be a one-night screening turned into a 3-night screening with over 500 women who came out for it. And that's where I knew there was something magical happening. Mm-hmm. And I saw the audience. My husband was in the back and he wasn't really sold on the whole thing yet. He was, he was like, it's a 6-minute documentary. Who's really going to sit there for that long? You're going to lose people. So I watched it and I had tears in my eyes when I first saw it. I was like, no, I don't think so. I think there's something here. And he was witness to something that he couldn't even put a word to. He was like, you found something. This is it. This is the community. These women have questions. They wouldn't stop with the panel. Each night, it was just a different, amount of energy in the room. And it just kept brewing and just kind of, fueled my fire. So after I was done with that, I was like, okay, you know what? And I would see my patients in the office like, so what's next, doc? What else are you going to do? That was so great, but we want to know more and this and that. And I wasn't even that active on social media yet at that point. Again, this is just November. And that's when I started planning the Empower event. And I reached out to all the docs I had met in Chicago at the Menopause Society meeting and said, would you be willing to come down? Would you want to come to Miami for a weekend and help me out with this event? And I got an overwhelming response.
Isn't that amazing?
I mean, I was floored. I was expecting 4 or 5, and by the end I was like, I have 18 speakers coming. This is insane. Like,
That's
what do I do?
amazing.
I was blown away, and it's fabulous people from all across the country. You know all of them,
Yeah.
and it was just inspiring to put it together and to see the day come together. And it was from 9 in the morning till almost 6 p.m. And they were there taking notes, feverishly asking questions. The panel could have kept going for hours at the end. And I knew it. I felt it. I was like, this is it. This is what I'm here for. It's not really, it was not to promote anything. It was really to bring everyone together, to educate them, and to show them what's possible. And we're not done. Like, I could have been retired. My husband was like, you should have just retired. It would have been, financially more feasible that way. But then to see that day evolve, he was like, I see your passion. I see the road in front of you, and I'm here to support. So what can we do next? So, that's where it's all coming from. But that event really touched upon all aspects of women's midlife health, a psychological, mental well-being, journaling, fitness, nutrition, hormone therapy and cancer survivors. I mean, you name it, we had it.
And it just goes to show the power of what happens when all of those collective voices are together. I've said this from day one, whether it's politicians, researchers, providers, celebrities, if we all stand together. And so women don't have to be competitive. We can be collaborative. There is such an unbelievable need for this type of care and this type of education and frankly community, because women start to feel so alone when they are turned away from doctor after doctor, told it's all in their head, told or just denied hormone therapy. And so yeah, that's what moved me so many years ago. And when they asked me to be part of the film, it was supposed to be such a small thing because they were told over and over again, there's no market for this movie. And the first time I saw it, number one, I learned that menopause was not only coming for our hair and vagina, but also our teeth, which, I knew about the hair and the vagina, but I did not know about the teeth. So I learned from the movie, which I thought was really cool. But I remember watching people's response to the film because I had seen bits and pieces of it while filming. And I was blown away because you definitely see, and we'd thrown events for years as part of her MD, but to see that reaction in that format, because that was the first time that I was a part of a project like that, I can't even put into words. And my husband was at the screening with me, and he is a cancer doctor, and he was almost moved to tears. He's like, this is incredible what you all are doing together for these patients, who have basically felt invisible for decades.
Correct. Yeah.
I love that so much. So we're going to do some rapid fire. You ready for some rapid fire fun?
Let's do it. Let's do it.
Let's do it. What's your go-to analogy when explaining hormone therapy to skeptical patients?
Good one. Let me see. Let's look at it like, so I have a bunch, depends on who I'm talking to, I think. It's like, okay, so are you somebody who's very nature-based, or if you're, a health person or a techie person, things, I really, tweak it per se for them. And let's say I have a patient who's on thyroid medication, I throw it at him that way. I said, you have hypothyroidism. You were told you need to be on Synthroid for the rest of your life. How do you feel about that? Oh, well, that's what I need to do. That's what I need to do. I said, but then look at the ovary as another organ, which it is. Okay. It's providing you hormones, and now it doesn't want to anymore. You just need to replace it. That's it. And they're
End
like,
of story.
that's it? I'm like, yeah, because that's the honest truth of it. It's not, it's hormone management, therapy, optimization, whatever term you want to give it. And they're like, well, how long do I need to be on this? 10 years to start, and then we'll see how it goes after that. But, there is no endpoint deadline. There's none of that. As long as you have a healthcare provider that you follow up with and you have an open, dialogue with. Or another good one I think that gets them is Wi-Fi. Hormones are your Wi-Fi signal. If you have shoddy Wi-Fi happening and things are not downloading, what's going on? You're low on estrogen and progesterone, maybe testosterone. So the signals aren't happening from the brain to the body to the other parts. So we need to correct the Wi-Fi. We need to buffer you better. So
I might borrow that one. I really like that one because I feel like a lot of people would lock on to that
yeah,
one.
because they get it. They get Wi-Fi. They're like, oh yeah, okay, that makes sense. Okay.
What do you think the most misunderstood menopause symptom is?
The mood ones and the anxiety.
Yes.
They're not expecting it. They think it's life. They think it's them because remember, perimenopause is late 30s, early 40s. And
Right.
who's there? It's all these young moms with little kids running around, going from school drop off to soccer, this, that, after school activities. And we manage it usually very well. I was a mom, 3 kids, all a year apart. So like I was in it. And we start doing everything, and then all of a sudden things start falling through the cracks, and you're like, what happened? Like, why am I not remembering? Or why am I more anxious? Or why am I more testy all of a sudden? I think that's where they're not connecting the dots, and they think it's them, and that's where they go to the primary. Oh, maybe you just have a lot of anxiety. Let's put you on some, anxiolytics or antidepressants or things like that to calm it down. And we're missing that puzzle piece, and so we need to really hone in.
And don't you think this is where, aside from weight gain, it's the number one place I see women blame themselves? They literally, the chief complaint will be, I'm going crazy. And it's like, why are you calling yourself crazy? Like, this is a symptom of what's going on with you, of honestly estrogen deprivation. But they'll be so quick to lock on to that, I'm going crazy. And that's part of the talking to them and treating them and saying, okay, no, you're not. There's a reason you're feeling this way. And better yet, there's treatments available that you will probably like and will benefit other body parts. And so speaking of that, what part of the body do we under talk about in hormone care?
2 of them that I feel is not discussed enough, and there's still taboo around. The first is sexual health. There's taboo. Complete
For sure.
taboo. It doesn't happen. You don't talk about it. Doc, why are you asking me that? I'm like, well, I'm your gynecologist. If you can't tell me, I don't really know who you can tell. And so it takes them aback a little bit. They're like, oh, well, I think it's fine. I don't know. What do you mean you think? It should be great. You're past having to worry about having babies. You're financially stable in your relationship with your husband, your partner, whatever have you. So this is where it should be taking off. Responsibilities are less, kids are older. You should be having an amazing sex life. You should be intimate with your partner. You should be great. No, well, I just do it because I need to do it. I mean, I'm better, I could care less. And that's where I'm like, okay, well, and you and I are on a lot of same page with that one because I love Addie. Addie and I, we get along, and my patients, they have been my anecdotal trial in front of me. I've had, I want to say, almost 100 patients on it now, and no one, knock on wood, has had a negative effect. And what I've noticed with Addie is between a month, it was with the quickest response, and 5 months was the longest response. But none of them, they're like, why does nobody tell us about this? Because number one, we don't talk about women's sexual health because it's taboo. And number 2, we don't talk about FDA approved options that we have out there. So it's
No, I had an intern who worked at her MD, is in medical school now, was having a sexual health lecture, and the professor told her there are no FDA approved medications for sexual health for women. And so she didn't raise her hand during the lecture because she didn't want to be that person. But she actually came up to the professor and said, there's both Addie and Vyleesi, and Addie's been on the market for almost a decade. And the professor was actually very nice about it and said, how do you know this?
right.
And she's like, well, I worked at her MD, and actually, I learned under Dr. Javed. So I've got multiple published posters with Addie because I became so passionate about it, because I was so tired of telling women, well, I don't know what to do. Your husband just got the blue pill, and, this is before I was prescribing testosterone and before I had learned about sexual health. And then I started prescribing Addie and treating people with testosterone, and was told I've saved marriages and saved lives because people were afraid they were going to lose their, their relationships and their self-identity and their confidence, because we know what goes on in the bedroom affects so many other aspects of your life. And so for me, very passionate about Addie, have seen immense success. I've started to see difference in 2 weeks, and that's not with maybe the number of sexual encounters or the increased libido or the decreased distress, but the little subtle signals I'll see in 2 weeks are less avoidance, like instead of not wanting to go to bed at the same time because you don't want to say no, spontaneous sexual thoughts.
Right.
If there's something suggestive that they're reading or something racy or sexy on TV, rather than feeling dead or nothing, they're like, there's some tinglings going on, So those are, and then the funniest one is sexual dreams.
Yes.
Yes.
I've gotten those.
And I
tell
am,
me. Yeah.
they tell you. And so I'm a girl from Cleveland, Ohio. I'm now in Cincinnati, avid sports fan. And I remember this patient being so happy to tell me this story because she knew this. And she goes, Dr. Gervais, I am dreaming about sex again. I go, ooh, tell me more. And she was like, I had a dream about LeBron James. And I looked at her and I said, are you from Cleveland? And she's like, no. And I was like, LeBron James? She goes, hey man, I'm just so happy that I'm dreaming about sex again. I go, no, he's totally adorable and brought me a championship. But I just thought it was hysterical. So yeah, they start dreaming about sex again. So those are some of the changes that I've noticed with Addie. And we actually have data in breast cancer patients, postmenopausal patients. So hopefully, the FDA is fast tracking.
Get it. Yes. Hopefully we'll get that next. That would be amazing.
Yes, because you and I may be, willing to write it off label, but I think it's really being withheld for a lot of women who struggle in those menopausal years with low libido. And I think that if we remove that another barrier, that we'll be able to treat, the 43% of women that struggle with sexual dysfunction. And that number is probably higher when you look at the menopausal population.
100%.
So we've both seen women after they've been misdiagnosed and told, just wait it out or come back in 6 months. What's one thing you wish every provider said out loud to their patients in midlife?
That it's not all in your head and that I hear you and I'm here to help you.
Oh, I love that. Because even that just makes them seen and heard, right?
I've been heard. I had a patient here 2 weeks ago and she canceled the appointment a few times. So I knew something was off. And she finally came from about up north, so about an hour away. And she sat down and she told me her story because that's how I do it. I'm like, sit down and let's just talk. Like it's not, it's very comfy, inviting, safe. So I just want to hear what's been going on. She goes, this has been going on for 7 years. I've been going from doctor to doctor to doctor. And the last one wrote in my chart that I need a psych evaluation from, a very reputable center. And she didn't want to come today because she figured I was just going to do the same thing and just write her off. And by the time she left, she said, even though you haven't done anything for me yet, you listened to me. And I'm so glad that I came all the way down here.
I love that. Doesn't that make you feel so good?
That's it. I was like, my day's made. I don't need to do anything else today. I feel amazing. And I told her, I said, you made my day. If you feel good, you don't know what that just did for me as a provider and as, okay, you know what? I'm going to keep going. I'm going to do more stuff tomorrow. So it's that's where it's at. Just listening. Half the time, we don't even have to do a lot. We tweak a little hormone patch here and there and they think we're amazing and we're lifesavers. And we are in a way, but I don't feel that. I feel this is our duty.
It's our absolute duty. And I think it's because women have just been settling for so long with so little that it doesn't take much to make a huge difference in their day and their self-confidence. So I started Her MD, 10 years ago. And one of the younger entrepreneurs called me the OG. And I was like, is that a compliment or is that I was like, I don't know if I want to be the OG. But now let's jump ahead another 10 years because even where we're now, I'm so happy compared to where we were 10 years ago. And we've hopefully fixed a lot of the problems in the system. So maybe insurance now supports menopausal care, data drives access, and women actually get the full spectrum support. What do we have to burn down to get there?
Oh my God. Yeah. There's so many things. We have a lot of barriers we need to burn down to get there. I think the first thing would be to, take out that outdated belief that midlife symptoms are just in our head. Number one, that's got to go. The misinterpreted studies need to go. Like, just throw them out the window,
Bye.
burn them. Okay.
Yes.
Medical training, the gap has to be filled.
Yes.
We need to teach in medical school, in residency. And you know what? If we need to divide the residency into two, OB and GYN, let's do it. Let's go for it.
I love that. Then let the people who want to deliver babies, which is amazing, but let them do that.
Let them do that. Yes. And let us do the gynecology and the surgery and the menopause, perimenopause care, and be amazing at it. Because you know what? Not everybody wants to be an obstetrician, and that's okay. Okay,
Yeah.
we've done it. We've delivered thousands of babies, and we have it under our belt, and we feel great about it. But it's okay. There's plenty of amazing obstetricians. We have a imbalance in our subspecialty where OB is outweighing GYN. So we need to fix that imbalance. And I think the way to do it is to separate them.
Yeah, I love that.
Us do that. We need to do that.
Let's save the world one vagina at a time.
At a time, 100%. I'm all for it. And I think if that happens, then insurance, right? Insurance will start to see this is not elective to make women feel better. This is health, longevity. This is keeping them healthier, longer. Therefore, in the long run, you pay less. So let's do that.
And the data will support that by preventing disease, we'll actually save not only patients money, but the entire system money. And so I think what we've learned today is that we don't just track hot flashes. We track clarity, strength, sleep, sex drive. It's all hormonal data. You can ask your provider for data. I believe in, like you, giving people information, giving them data, giving them metrics, whether it's about their brain health or their cardiac health or their cholesterol or, their hormonal labs. Give women the data so that you can get a curated treatment plan for you, because hormone therapy is nuanced. And then partner with a provider who talks with you, not at you. And I would say my one final takeaway from today is, if it doesn't serve us, go ahead and burn it down. So I want to thank you so much for being here with me today. Can you tell the listeners, because you are such a disruptor, where to find you and what you're up to next?
So I'm in Miami, Florida. My next, big step is going to be to go full time in my private practice at Gila MD. So that I've done a soft launch. So the actual physical, grand opening will be later this year. And you can find me on social media, on my Instagram, Dr. Jila Senemar, and on my podcast where I talk to people about all things women's health related.
And your podcast name?
Her Time, Her Health with Dr. Jila.
Love it. We've both seen the eye rolls, heard the myths. We've watched women walk away from appointments more confused than when they first walked in, but it doesn't have to be this way. Menopause isn't a mystery. It's just been misrepresented. And when you finally find a provider who listens, like Dr. Jila, you stop just trying to survive and you start building. Thank you so much for joining today and continuing to be a strong voice in the field and disrupting healthcare for women everywhere.
Thank you for having me today.